We have Dr. Arun Sethi, who runs a very large charitable organization and regularly uses the social media to promote the organization, to gather funds for networking. So he's one of the best networking people that I know, with his contacts ranging from ambassadors of countries which I can't pronounce by name to the common man, and a lot of people in the US and other places know of him and send him funds. So evidently he's doing something right with the social media.
Much, Kuresh, for your kind introduction, but that's not true. I consider myself a Badralok, which is a common man, and interact with the common man, and that, believe me, is the way to go forward. Now, the topic that is given to me is very specific. How do you use newsletter to and create awareness in social media about your fundraising or the program that you do? See, my background is I come from Xavier's, Delhi, then Christian Medical College, Arvind Eye Hospital, and Mass Eye Infirmary. So everywhere I saw community ophthalmology to a large extent. So that motivated me, and I went with my wife into this. And when we started small. We saw first patient under a tree. There was this American doctor visiting, and we made friends, and we went into Badarpur and saw. From there it's grown. Now we are touching 1.5 million patients. What it does, along with doing community work, is that you need funds. Now, how do you raise funds? Now, that is the most challenging task in India, because Indians by nature do not fund projects. They fund religion. They fund social activities, but they will not fund projects. It's the West that funds projects because they have a different mindset. So that is the first thing we learned. Second is, what kind of social media do you use? Since mine is specifically targeted on newsletters, so the idea of newsletter came because we used to see Orbis and all these, having very nice newsletters coming in and how to use it. Now, I would suggest, like everybody is doing here, that just as we have Numero NO doing the AIOS social media, everybody should have a social media consultant to guide you for, whatever you want to do, YouTube or this, because there's a certain way of looking at it. The ophthalmologists see it very, very narrowly. We don't look at it. Now, tell you about a newsletter. Now, this is one of our old newsletters when we started. And so we wanted to tell you that what we are doing. So this gives you the impact of, we have a hospital, we run specialty clinics and outreach services. Then we recently did again a pan-ophthalmologica. The response we had on the science side, the faculty, the presentations are all uploaded. Then we talk about our surgical camps that we're doing. So we go into the interiors, in the villages, screen, bring patients back for free surgery and how we do that. Now we have tied up with the Commissioner of Gurgaon. So there we're talking about how he has been helping us through the official machinery, primary health centers and others to generate awareness, to bring those patients in for surgery. Now these are some of the other side of the positive side of our work that also brings you occasionally an award, and it tells you how we interact with the different statistics, so how we are doing every month. We try to tell you that. The kind of visitors we have patients, we have VIPs coming. So what we do is we encourage them that if you don't mind, would you like to use the mileage to create awareness? Because like we had Aishwarya Rai yesterday, because she creates awareness of the conference. So I would say it goes to more social media than it would have if you'd got the Deputy Chief Minister of Maharashtra. So, you have to be very clear about what you're looking at. And so these are a list of visitors we had during the AIOC in Gurgaon. So you can see that we handled quite a few. While the AIOC was running, we were also running a parallel thing. And this is, we bring out our old partners. So we started with Deseret International Foundation. That's a doctor I worked with from 1990. He's 87, still strong in Utah. We'll be meeting in August at the American Academy meeting in Salt Lake City. So this is Mitt Romney, who stood for elections against President Obama. So he's on the board of a hospital along with quite a few from Vision, Charity Vision. So he was here for 2 weeks about 4 years ago. And this was because they were trying to give him a positive mileage, but Mr. Trump took away the presidency from him. So you get to an idea that we have these websites and we do that. So what I was trying to say is that how does it help? Today, emailers, the concept of emailers is actually dying out, commercial emailers or fundraising emailers. Less than 4% people click. Less than 1% read. So you can imagine that we have a database of about, I would say, around 60,000 mailers, which we send out every quarterly. So you can imagine it turns out that hardly about 4,000 people will click, hardly about 50. But then you're looking for that one person with whom you can connect, and that can make it work for you. And that is how it works. We had a patient once, he was the chairman of State Bank of India, one of the divisions. He came, he had a glaucoma problem, we sorted it out, and he gave us a van. So, you never know how things will happen. And where you hope to get something, when you know somebody, like I live in a colony of millionaires, and when you ask them for funds, they stop walking with you. So it has a negative effect also. My immediate neighbor is Kapil Sibal, he's a lawyer. So he's so busy talking about his philanthropic work, but he's never donated a 100 rupee note. So and every donor is very clever. They will only donate where it's bang for the buck. So they are more choosy, more this thing than getting a bank loan. So if you can raise funds from the Lions Club and Rotary Club, believe me, you've got a good project going. But the problem with donors is they're not consistent. They come once in a while. Very few with like Orbis or who have reached a charity vision, who have reached that level of operation like Tata Trust, they can do it. Do you all know where we are sitting today is owned by the Reliance Foundation? This is a non-profit activity. Do you see any non-profit activity? We are paying for everything, but it's income tax free. The entire thing is a blessing of Mrs. Ambani to the doctors of India. Thank you very much.
I don't know where you got a chance to read their balance sheets, but they never told us once when we were negotiating with them that this is non-for-profit. We've paid in crores for this place. Anyway, thank you, Arun. So this is a very niche area that he is in, where he's raising funds. It's an extremely difficult thing to do, which he does very well. And of course, the newsletter is only one of the ways that he raises. We asked him to speak on